Hey, Steve Grant here again, and again I'm joined with Albert, and we're going to be talking about change coaching, and specifically today we're going to be talking about the subject of fear. So fear's a really interesting one because I think when it comes to change in behaviour, people often, fear what's next. They're not too sure, if I do this, then what if that? So oftentimes we create these kind of stories that sometimes prevent us from making change. Do you want to just expand on the kind of subject of fear a little bit?
Yeah, expand. We could probably expand for a couple of hours. But yeah, you're very right, Steve. It's interesting because I think fear would often even keep people from coming to coaching because there's that sense of commitment that you're making to change. And it's interesting because often what happens is we have this feeling of fear. So it's an experience, right? It's an emotion and it's a physiological reaction. And then just that reaction makes us shut down. So we don't even explore what is happening for me mentally. So we'll say, I'm scared of making a change. But when I ask you about what the change actually means, a lot of people haven't even thought through that. So an interesting thing that we'd work on when it is fear, or when fear is involved, is to help people get a little bit clearer with exactly what it is that they fear. Because the minute you do, you already start getting more clarity. You already feel a little bit less scared because the unknown is less, and then we have something to work with. If you just say you're scared of change, I have no idea what that means to you, because your version of change might be a lot different to someone else's. And unless we unpack what that is, we also don't know, is my fear just a reaction, kind of a body reaction, something that's irrational? Or is it something that we can work with, something practical that we don't have to be scared of, depending on exactly what it is?
So in a sense, I fear failure, and then what might that mean to me instead?
Yeah. So it is about, so what does failure look like? What do you feel will happen when you fail? So an interesting thing, people don't often think about it this way, or it seems counterintuitive. When you're scared of something, one of the best things to do is to mentally play into that. So start imagining worst case scenario. Because when you push your mind into worst case scenario, you realize that the initial experience and dread, it doesn't even come close to what would actually happen. Often what would actually happen is very small.
That's a really interesting thing because so much everyone's all about you must stay positive and you've got to look at the best case scenario, and before they're posting the most positive kind of meme on Instagram or something like that. So it's interesting you actually say sometimes it's actually good to look at worst case scenario, to go through those steps and to actually break down what worst case scenario might look like. Is that what you're saying?
Absolutely.
Yeah.
So I mean, there's situations in which we imagine worst case scenario and we make ourselves anxious about that. But what I mean in terms of worst case scenario is to try and be as practical and as realistic as possible. So instead of just being scared, be clear with yourself about what you're scared of and see if the impact of that is as bad as you feel. Because often people will say, and then this, and then that, and then I'd end up on the street. And then I'd say, and then they realize, well, ending up on the street is awful, but it's not as close to the emotional experience they initially set up for themselves. And also, it's worst case scenario. The chances of that happening is very low.
Yeah.
So it's often playing it out enough so that you get to a place where you're mentally more comfortable with the decision. And then the first step is a lot easier.
So that's quite an interesting skill then, isn't it? To be able to actually look at worst case scenario, but at a very rational level, that you're actually able to break it down and go, actually, do you know what? It's not that bad as I work through that worst case scenario. Rather than, I guess, a lot of people go worst case scenario and they just get caught up in that emotion of worst case scenario and then never really kind of rationalize that or understand it. Is that
absolutely,
right?
Yeah. And also being conscious that this is mental exercise. And what am I experiencing now? So part of the work is getting clear mentally and with your mental models and how you think about this, the stories you tell yourself. And then emotionally, how am I coping with this now? How am I regulating my own experience? So part of the work is regulating your own emotional state. So if I start thinking through this, I don't get so emotionally worked up that I can't think straight, which is also what happens.
So that's an interesting thing. So I work quite a lot with stunt performers in the film industry. So, they do crazy stuff.
Yeah.
Set themselves on fire, jump off of bridges, get smashed around all the time. And it's interesting because, when you look at some of the things that they would do, you would expect there to be a lot of fear involved. Let's take, for example, someone wants to set themselves on fire and jump off a bridge.
Yeah.
Now, they don't go from never having set themselves on fire and never having jumped off a bridge to set themselves on jumping off a bridge. So there's a layering approach with that they kind of get used to that environment, so that then they're in that environment at which they actually feel, to some degree, there's obviously still going to be an element of fear there because things can go wrong, you know. But to some degree, they're more comfortable in it, that they're actually able to perform and do what they need to do. Do you think there's a carryover there, with just like kind of like general health and people like?
Yeah, I mean,
we would normally see.
I haven't recently coached someone to jump off a bridge. If anything, I've coached them away from bridges. But the two things that I'm picking up that definitely translate well is the one is staging and in some ways. Rationing the process. So instead of starting in the ocean or jumping off a bridge, you start off small. You jump off a little ledge, and it seems small, but it should be small. So it should be achievable. And what you're doing is, one, mentally you're preparing yourself for what's coming, but also you're training your nervous system to get used to part of that end result. So the feeling of jumping off a bridge, your nervous system says, "Oh, I know this is okay," but it won't know this if you put yourself in that position from the start. So being gradual with the process is one way that we do it. The other thing that comes to mind in that is the mindset that you need to have around, there will always be something that's unknown, but I can look at what is known and what's available to me. So the stunt performers don't focus on what could go wrong. They focus on all their safety procedures that they need to put in place before they jump off. That's where the focus is. That makes them feel secure as well, because they know these things are in place. There's a safety net, there's a harness, there's whatever there is. And when they have that, their sense of confidence and ease to take the leap is a lot bigger, because their focus is on that rather than on the 1 or 0.1% that could go wrong.
And if you were to take someone, let's just say hypothetically a client that has that is overweight, maybe has some IBS issues, and we're looking to maybe change their diet to, you know, do a bit of a body transformation and change some of their digestive issues. Do you see there being kind of a relationship between that stunt performer having gone through those things and maybe this person that's actually, in a sense, looking to change their identity in a way? And there can sometimes be a fear or a loss of identity that comes with sometimes positive behavior, kind of physical change or
absolutely.
Emotional change.
No, it's interesting, and for people who haven't necessarily struggled with weight as much, it's sometimes hard to get how important that becomes as part of someone who's overweight, their identity. Some people actually don't realize that their being overweight is a protective mechanism, and the minute they start losing weight, people treat them differently. The environment's different, they feel different about their bodies, and that shift can be scary because it's so different. So the work that we do is, in one way, bracing them for that. So it's important, and that's what the stunt performers do. You don't just push them off the bridge, they know it's coming. So part of the work we'll do is preparing them for when things change, what are we going to do? How are we going to set you up? And the other thing is, when we're in that transition, how do we manage the emotional state? And how do we manage the stories we tell ourselves? Because part of identity is stories we tell ourselves about who we are. So that needs rescripting as well. So the change is never just the body. It always includes the mind and the emotions as well. Yeah,
I think that's really interesting, because I know that I've personally experienced, having worked with clients, and especially in the kind of weight loss sort of realm, that actually you can get to a certain point with a client and then almost there becomes a block or a resistance to change at that point. And there's definitely kind of some underlying kind of emotions and psychological things going on that are actually preventing them from breaking that barrier of which they sort of almost become accustomed to. But we assume that just losing weight and improving body composition is always just a positive thing. We don't actually realise that there's a whole bunch of emotions that are underlying the reason why maybe someone's increase their body weight and body fat to start off with, and then as they progress back towards that space again, right?
Yeah, a good principle that I've picked up through coaching and therapy as well is, it's always, and I try to include this when we talk about negatives. I'm overweight, I'm critical, I'm very aggressive, I'm angry, whatever, I'm lazy. is to help people identify how does that serve you, because there's a reason that you are doing what you're doing, or that you're reacting the way you're acting. So it helps us to see, well, being overweight has served me. How? Assume that has served you, otherwise you wouldn't be overweight. It's not just the eating that serves you, but actually eventually being a certain body type has a purpose for you. It creates a certain dynamic in your world. So unless we can identify its usefulness, we're not prepared for the loss, because the loss isn't positive. It will be losing whatever that being overweight gave me, and then discovering, well, what can I replace that with?
So that's a really interesting thing, because a lot of the time for people it can be that food is actually acting as a comfort to soothe or deal with or cope with emotions or traumas that have happened in the past. So when you look to change someone's diet, you take away that coping mechanism.
Yeah, absolutely.
So then actually what you're left with is an inability to cope with maybe some of the emotions that have been present at that time. It's like, well,
what do I do now?
What do you do now? That's only going to last for so long. So you either need to, I guess, break that down or find other kind of more, I guess, health benefiting coping strategies to be able to deal with those emotions, right?
No, absolutely. And that's one of the most common things, whether it's weight loss or anything else, is helping people develop. Because I think one of the big causes for most of the destructive behaviors is emotions and our inability to process and handle the uncertainties of life, the difficulties, the challenges, relational breakups, whatever it is. And we find something that is comforting. Food is comforting. Drugs is comforting. Alcohol is comforting. It does serve a purpose. So helping someone break that habit, they do need something else, because life's not going to become easier suddenly. They're just going to be a bit more exposed to it.
Yeah.
So a big part of change, and especially with fear or any of the other more challenging emotions, is how do we handle that emotion in a way that supports us and that sustains our life and that is health conducive, rather than in ways that can create other problems down the line.
Cool. So from what I'm understanding, I guess is a little bit of a summary, is that we can actually take this emotion of fear and then we can download it a little bit and try and understand the mechanisms at which are actually driving that fear. And it's those mechanisms that are driving fear, which is where we want to actually kind of support someone and work with them on that level. Is that right?
Yeah, absolutely. Because it's not just about getting you to do something even if you're scared. It's about, we get that you're scared. How do we support you to feel less scared and find coping mechanisms and strategies to support you, especially if you're going to make changes, because the fear is just going to be more, the uncertainty is big.
Yeah.
So it is actually about building safety and making clients feel more comfortable and confident within themselves. And then the fear becomes less, which is great.
Cool, amazing. So I think that's a really good point just to finish on there, but a really nice summary into that kind of area of fear, because that's often such a blocking factor for people when they're trying to make change, whether it is body composition, whether it is jumping off a bridge, as a stunt performer. That is probably not the best analogy for us to have used, or whether it's just making health changes and trying to improve just general health as well. So thanks, Albert, for that.
Cool.
I appreciate it.
Welcome.